Why do you feel that we should still care about COVID? It's a big subject.
I think we should care about respiratory viruses in general and being
Agreed.
able to differentiate between SARS-CoV-2, the virus that causes COVID, influenza, flu, respiratory syncytial virus, right? RSV. I think it's important to differentiate between those three viruses because those viruses wreak the most havoc in human beings, right? That's one. And then two is there are treatment regimens for individuals that are susceptible or for individuals that become really symptomatic.
Right.
It's one thing to understand that individuals who have lung disease, individuals who have chronic inflammation of the lung, whether it's asthma, whether it's interstitial lung disease, individuals who have dead lung, which is emphysema or COPD, it's easy to see why these individuals actually are more susceptible to respiratory viruses because they don't have that reserve in their lung, right? They have inflammation already. A virus comes, more
No
inflammation, no reserve.
Yeah.
You're going to be really sick. So I think it's important for us as clinicians, for us as healthcare providers, to provide that information to patients that could potentially get really sick and give them information on the different therapies, right? So SARS-CoV-2, influenza, RSV.
Yeah.
I talked a little bit about RSV. I said, listen, there's vaccines for individuals who are 60 and over. There's a maternal vaccine for females and their infants that are going to be born, who are about 34 or 32 weeks, whatever, pregnant. And then there is an antibody therapy for kids, a prevention strategy for kids who are born, right? They can get this monoclonal antibody and it prevents RSV from binding. For influenza, because of the H5N1 potential, which
Right.
everybody's worried about, the bird flu.
Yes.
And again, just to remind everybody, hemagglutinin, neuraminidase, proteins on the outside of the virus, all the numbers are just a type, like what it looks like exactly.
Right.
H5N1, H1N1, all that, it's just a type of protein. But influenza is influenza. And there are oral therapies, antivirals, that we can use to treat it. It's just that as soon as you're symptomatic, that's when we want to initiate those therapies.
How do we prevent it?
Yeah. The way to prevent disease, which is what we're preventing. So a lot of people look at vaccination as preventing infection. Like they'll say some stuff like, well, I got the vaccine and I still had COVID, or I got the vaccine and I still
Right.
got flu.
Yeah.
Yeah, well, yeah, you're supposed to.
And then they never want to get the vaccine again.
Right. So what people have to understand is that like vaccines don't prevent infections. Vaccines prevent severe disease. So all a vaccine is a little piece of a virus.
Right.
Or a dead or a weakened virus. But I want to reverse a little bit. And this is going to be, again, a little bit of learning. So I'm just going to look into the camera. So when you're infected with a virus, when you're infected with a bacteria, when you're infected with a fungus, whatever it is, these are organisms, right? So they all have a certain way that they look. What your body does, once it sees this organism, it cuts it up into little pieces. As it cuts it up into little pieces, your cells recognize the different pieces. And when they recognize the different pieces, they either make antibodies to recognize one of the proteins, or they make cells to recognize one of the proteins, right? And then when it does that, then your immune system is allowed to go out and clear the virus or bacteria or fungi or whatever is causing the issue. But what happens is wherever the virus or bacteria presents itself, so like in the lung, it's an end organ, right? If your lung is congested, like you could potentially die because it's an end organ, it's a vital organ, it's the only organ that provides oxygen for your body. So that's the danger there, right? Is that process of recognizing the organism, cutting it up into little pieces, and then manufacturing products that recognize these pieces. All of that takes place in the lung, and it takes up space. And that's what can cause your shortness of breath and all of that. That is how an infection works, right? So what a vaccine is you understand the structure and function of the organism. So you know what flu looks like. So what you do is you take little pieces of the H and little pieces of the N, and you put it in a vial, and then you inject it in your muscle, when you inject it in your muscle, right, your immune system recognizes those little pieces in your muscle, not in your end organ like the lung, right? So recognize those little pieces in your muscle, and then your muscle hurts. It's supposed to hurt because that's just inflammation there, right? So when it does that, your white blood cells take that information to the main freeway of all white blood cells. It's called the lymph system. And then it tells everybody what to do. It's like, hey, this is what flu looks like. All right, take this back to your friends. And then it goes back, right? Like
Right.
that's all it is, right? It's just telling your friends what Bobby looks like. It's like if you were to come over to my house and you didn't know who my friends were, I'll be like, oh, you want to see Jaywalk? He's got dreads. He's about 6'2".
Yeah.
He looks like he played football for USC because he did, right? And you would be
I
like,
like
oh,
this analogy.
right, that's probably Jaywalk, right? And so that's all the immune system is doing with the vaccines. It's like, oh, okay, this is what H&N looks like. Got it. So when flu shows up, your body's like, oh, that's just Jaywalk. That's just Heather. Will you go deal with that? And that's it, right?
That's
It's not an overreaction or over response. So when people ask questions like, well, how do we prevent infection? You're not going to prevent infection. The real question is, how do we prevent severe disease, right? How do we prevent our kids from being in the hospital? How do we prevent our kids from being really sick?
Right,
Well, that's what
right.
vaccines do, right? Is they prevent your immune system's overreaction to the presence. It's like your immune system knows what's up now, so it's like relaxed about it, right? That's how vaccines work.